And we are requesting, so I'll go to the next page. That you please update the descriptions of your department. Yung simple lang, 3 years, 4 years residency when it first started. But more importantly, please send through June or Sean dun sa chat group natin um, an update on the fellowship programs offered kasi baka may hindi na complete dito. For the urology department, we agreed with Doc Latayan, I called him last Friday, that for now, it will be considered as a residency, parang a straight residency training program. Because this is also acceptable to the Board of Urology. So, nakalagay dito yung admission process, para alam nyo lang. Nakalagay dito yung roles and responsibilities and requirements for graduation. I will not touch on this because Sean, tama siya, no? We'll talk more about this a bit later. So, although this is small, let's try to enlarge it. I want you to focus on the responsibilities of the chief residents because I want you oriented. Kung hindi man na-endorse sa inyo ng outgoing chief residents. So, first, you have to act as a liaison between the residents and consultants. So, a broad responsibility is upon your shoulders. Next, in the absence of your consultants, you are considered the supervisor of the residents. And if there are problems, please make sure that your consultants know it, especially if these are problems relating to patient care and some errors in patient care, they should immediately know it. Next, you should participate in teaching and training of the medical students, affiliates, and of course, your junior residents. The same assignments for the senior residents. You will perform administrative tasks assigned by the department consultants, and of course, you can be assigned tasks by Dr. Dan, Dr. Arancel, and myself, and membership into the various hospital committees. So when you become members of the various hospital committees as chief residents, you have to inform your departments what is happening there, and of course, bring the department's concerns when you are called for meetings. You will also perform functions of the senior house officer, which I will tell you what those functions are later. And of course, you deliver clinical services as well, appropriate to your level of training. So do you have any questions or clarifications with regards to that rule? So right now, the major form of communication that we have is really our messenger group. And I hope you are all tuning into that. For any memos shared there, any announcements about vaccinations or hospital activities, we hope that you disseminate that immediately to your consultants because sometimes it is not disseminated to the MedMancom. So we expect that you share it with them, especially the schedules. Now, as senior house officers, as you can see, Dr. Fitz is requiring even the Department of Dermatology to perform the senior house officer functions. And ako in PGH, in my previous hospital, actually all the departments rotate as senior house officers. If you're a senior house officer, what should you do? You are actually acting in behalf of the medical center chief for decisions that might need to be elevated to the administration. In that case, if there are things that you don't know or you cannot decide about during your tour of duty as senior house officer, you may call me or you may actually call Dr. Arancel or Dr. Audan himself. You will have to stay in the hospital for 24 hours during your show duty, and I hope that June will endorse, probably within this week or next week, a show logbook. In the show logbook, all incidents that you have handled should be written there and any problems that you might have encountered. Then in case your department cannot go on duty as senior house officer, you can make internal arrangements with the next on duty. Just inform us because we submit this duty schedule to Dr. Arancel as well. Do you have any questions? Any questions? Understood ba? So let me go to this, ha. So one of the new things that was introduced by the Department of Health and was implemented sometime 2018, 2019 was the post-residency deployment. So a lot of you are asking, no, will an additional year of stay with SPMC be considered as deployment? We have already written several times, actually 4 or 5 times, with attachments from your individual departments regarding asking DOH that the retention as chief resident be considered as deployment, but their answers have been consistent. So this is my answer. In case you will be willing to extend as chief resident, I admire that, but after your stint with us, you will still have to be deployed. Before, when there was a surge, so yung last year or 2 years ago na batch, their extension as chief residence was counted as 3 months of deployment. But as of present time, wala pa kasing ganong pronouncements. So for now, it's anesthesia, surgery, OB, IM, and pedia that are being deployed. But there is a new department AO 2021 that I have not seen yet. And I think family and community medicine is mentioned there, but I'm not yet sure. And I will announce that in the arrangements that the PAFP is making with DOH when I get more information. So may questions ba kayo sa deployment? Okay lang sila, Sean? So I hope you understand. So thank you. For the rest of the departments, we don't know in the future if DOH will also deploy you, but for now, it's really this department, and I'm not yet certain about the status of family and community medicine, and we'll have to update you on that on our next meeting. So I will stop my sharing here. My next concern really is the concerns for the clinical that Dr. Arancel would want to talk to you about. So a large part of that concern will be tackled by IPCU later together with Dr. Alistante. But we hope you know that part of the responsibilities of doctors in all hospitals is really adequate documentation in order for us to be able to make sound claims. Pipresent na namin sa MedMancom, beginning the MedMancom meeting, the loss of income we have, specifically because our recording and record keeping was not good. So sa CIF, we can lose as much as parang hundreds of thousands to a million simply because it is unfilled. And I think the problem later that Jess and Dr. Alestante will raise to you is that we do the CIF for compliance, but it is very important. Wag po kayong, do not rely on the correction because what happens? The record that you actually fill up is what our molecular biology lab submits to DOH Resu, and if it is sent for genomic sequencing, this is what is submitted to the central office and to the RITM. Ang problema later on, pag mag-strict si PHIC, pag nireconcile nila yung sinubmit natin sa PHIC, which is corrected data, compared to the original data, baka ma-question tayo eh. So, as one particular parang saying goes, it is better to do things right the first time rather than correct. So lalo na ngayon na may interns na naman, especially in the major departments, we expect that the filling up of CIF is not routine but is actually what the patient really needs. And later, the specific details of what is usually lacking or what is usually erroneous that is frequently corrected will be mentioned by Jess. Not only that, I see your CF4 forms. Because when I look at data, when patients ask me, I see CF4 forms, although I don't disclose to them, I ask them to talk to the doctors. The CF4 forms are very blank. And these are the forms we also submit to the authorities. And if there will be disputes and claims, it is very important that this is properly filled up as well. Again, when your previous seniors were oriented, You don't need to really put in daily notes in the CF4, but the crucial ones need to be there. What are the crucial ones? If the patient's status change, if you introduce new diagnostics and new medications, of course, if you will discharge and admit the patient, and if you do operations or procedures to the patients, this should be documented because this is what is billed and this is what is charged. So those are the things that you shouldn't miss, including a full history and PE, and of course, a complete diagnosis or any change in diagnosis thereof that will support our claims. The last thing that Doc Fitz want to remind everyone, as chief residents, part of your role is really to help in administering. So please do remind the residents, especially if there are vacancies in your wards, because our ER now is a smaller ER, to please watch for turnaround times and admit the patients in the vacancies as soon as possible. Kasi nakikita namin ngayon, may vacancies sa wards, pero syempre marami ding full. Um, Overflowing ang ER. So we really need to help each other out because we are anticipating a surge. In terms of the policies for COVID, I'm asking KC to share a drive with us so that the updated policies will be there and it will be easier to access. But the latest policy, which IPCU later will again tell us more about, is this. Anyone coming from Manila or high-risk areas should subject themselves immediately to a 5-day quarantine upon arriving. And after that, they should inform PHS so that they will be swabbed on the 5th day. So that is the new policy that we have. But IPCU can also tell us later about that. So on my end, I am happy that you have accepted the Chief Residence and PGI Coordinator's position. So as Chief Residents, you will be the ones disseminating information to your co-residents, and you will also be the ones representing them in this forum where we meet. Although we will discuss some clinical matters when we meet, so ang suggestion ko kasi once every 2 months na lang tayo, so as not to also encroach on your busy schedule. The training concerns are the things that we will discuss here, and some of the clinical concerns also that affect training. For the major clinical concerns, requests for equipment, I think that should be brought up to the MedMancom, which is the proper forum to address those issues. Before I turn you over to Sean, this is your time to ask questions on deployment, on your role as chief resident, and on the things mentioned about decongesting the ER and the CIF. Meron ba kayong questions? Mukhang wala pa siya, or we can entertain them all together later. So I now turn you over again to Dr. Espanyol.
Good morning once again. I will share my slides. Ayan po. So I hope you see my slides. And then again, I would like to welcome all the chief residents and the PGI coordinators. We cannot sugarcoat it that your job for the next 365 days will be a smooth sailing one, but as much as possible, we would like to inform everyone that we are always here to help and support you in case you have questions and in case you need assistance with your role as chief res and PGI coordinators. And then, especially for the PGI coordinators, there are 136 PGIs this year. And it's such a gargantuan task, but we're here to help you and support you. So, for the role of the PGI coordinator, ito siya po. So, coordinate with PETD on PGI clerk schedule. So, if you are the PGI coordinator, please ensure that you are already included in the SPMC, Chief Residents, and PGI coordinators Facebook page. So, what usually transpires is that any information coming from APMC or Association of Philippine Medical Colleges Incorporated, any memos we receive from PETD, we do usually meet. There are 4 PGI coordinators. That's Doc Lin, which is the Chief Training Officer, me, Dr. Marijo Montales Lauردin, and Sir Jun Ayag. So we usually discuss what's the memo is all about, and afterwards I post it on the chief residence wall FB page. I do not post it on the GC so that it will not be uh, magulo later on. Baka marami kasing minsan kasi ang pinapadala ng mga memos ng APMC to 4 to 5 pages, and sometimes there's a 60-page memo. So usually pinopost ko na siya sa FB page. And then afterwards, if there are concerns with the memo, we usually have a dialogue between the PGI coordinators and us before we inform the PGIs, so that kung ano yung mga nitty-gritty of the memo, at least na-address na natin before we inform the PGIs. So far the memo was, the last memo dated was December 21, which is OPD rotations and non-COVID and regular ER rotations. But as we've mentioned, we still need to observe the trend of the cases before we implement as such, because the memo states that they are required to wear a level 3 PPE if they rotate on those areas. So di mo muna natin i-implement, and the PGI as well are informed with our decision. Number two is prepare areas of rotation during their department duty. It has been uh, we've always mentioned that to the previous PGI coordinators as well as the postgraduate interns, that once they rotate in your department, they are subject to your rules, your policies as well as your sanctions. So during orientation, what we usually do is just an overview on what to expect in general as a PGI, and what to expect when you go to rotate on different departments. However, the competencies, evaluation tools, and sanctions, we will leave that to the department. For those who are current chief res or PGI coordinators and there's no endorsement from your seniors, I will show you later on files for your reference. And if you have a draft already, like for example, you have submitted already your training manuals, so we've already read those. And then for some who haven't submitted their training manuals, kindly submit their training manuals. And then there's an instructional design format. There's a file reference. We will discuss it later on. And then prepare didactic lectures. So I believe it's already incorporated when they rotate in your department. So aside from endorsements, evidence-based medicine lectures, examinations, rotations. So we do expect that you create lectures on top of the Tuesday interns are. The Tuesday interns are is already embedded in the PGI program, and it's always Tuesday 1 to 4. But for this year, we will reinstate the interns are because they requested for special lectures. But before we reinstate that, we will give you a 2 weeks notice or a 1 week notice so that we can readjust your schedule. Okay po? And then in charge of the evaluation tools for PGI. So na yun. So you can, for the training manual for the PGI you can check actually for the PGI orientation 2022 PDF. It's already in the FB page. For sanction, also the same PGI orientation 2022 PDF. We already informed the interns during the start of orientation that you may adapt or may modify the sanction. So that's why we always emphasize that during first day of rotation, you have to conduct your orientation so that you can be clear on your policies as well as your sanctions. We are emphasizing this because there's two sanctions. Um, I think the mindset of the PGIs are so lenient because APMC is lenient as well. If you peruse the previous APMC memo kasi, when a PGI goes absent on a duty or any day during your rotation on your department, ang sanction lang kasi is a paperwork. There's no extension allowed. But always remember that you can impose an administrative sanction. Like for example, if during the absence of this PGI, you found out na nag dishonest siya sa iyang reason, or any reason that would warrant investigation, you can impose an extension or day extension. So for example, if you check the training manual for PGI orientation, our sanction for Like for example, dishonesty, cheating, or misbehavior is actually expulsion. But we can always have a first offense, second offense, third offense for for the benefit that these PGIs will be given a chance. For competencies, please refer to your department training manual because we do expect that it's your department. So as much as possible, you know the competencies that need for that PGI to learn before he leaves your department. And then for instructional design, actually it was required by the APMC for each department to create an instructional design as per requirement for renewal, but only a few departments submitted. So as much as possible, we do encourage everyone to create such instructional design because it would be easier for the department to go about and how you go about with your training with the PGIs. So there's an example, a Rev PGI ship instructional design PDF in the on the Facebook page. And if you want also a detailed on the instructional design on how to go about it, is explained in the final manual and IP PDF page. This is coming from the APMC. You can please go to page 69. Actually, it's more about competencies. How do you reach out with your competencies, kumari, lectures, didactics, and how do you evaluate, how do you score, and then remarks. Ganun lang siya. Ganun ang structure the design. It's quite challenging, but if you get the hang of it, it would be medyo easy na later on. So what we did suggest is that if you have a draft already, you can submit it to me so that we can collaborate on how we go about with your instructional designs because you know there might be things that you missed or there might be things that would be important for the learning of the PGI. And then if the department and if it's okay with the department, you can have your chairperson and your training officer sign that instructional design and submit it to us. Ganun po siya. So all of the files nandun lang sa FB page po, including the 1 year schedule. We always give the 1 year schedule at the beginning of the rotation. So for this year, starting during the pandemic, instead of July, the beginning of the rotation was moved to August. So they will end on July. And then um, always remember that we do apologize because we're just following APMC guidelines. For at present, the only areas that are allowed for face-to-face rotations are OB, IM, psychiatry, surgery, ENT, OFTA, and pediatrics. And then that's why we encourage everyone, if you check out the GC, the group chat again, that we encourage everyone to create a workshop. For the Department of Radiology, I already received your workshop. Please give us time to review it. So we encourage everyone to design a workshop. There are outline that we posted in the GC so that, and please ensure there's no face-to-face interaction with the patient so that these PGIs can rotate in your area. Okay po. So for now, and if you have teleconsultations also that could help in the learnings of these PGIs, at present we approve already the ophthalmology and family medicine or teleconsultation that could be done in OPD. So the same setup as much as possible. We will allow that provided that you can ensure that there's no patient to patient PGI to patient interaction. So usually the purpose of the teleconsultation is to enhance their history, PE, as well as to create a differential diagnosis, and then you can create a discussion around that later on. So yun po. For the wait, for the graduation is this Friday, January 14, 1 p.m. We just wrote 1:30 p.m. just to make sure that everyone will come in time. Uh, we will provide the link po for the graduating residents to the department's chairperson and training officers. And then for your loved ones or for the rest who will be attending the graduation, we will provide a link for the Facebook link because it will be televised for the Facebook through Facebook. With regards to the attire, kasi po virtual siya. So as much as possible, if there is a chance that you will be called and then kailangan i-on ang camera ninyo, make sure lang po naka semi-formal. With regards to color scheme, wala pong any color will do. So it's virtual platform, and we will send the link soon. And then with regards to the most outstanding resident, ortho na lang po pakisend ng inyong details sa inyong most outstanding resident because we have to grade them to arrive for the top three. So these are the, if you want to create a workshop for the PGIs, these were the suggested workshops that according to the survey that was done by the current PGI. So for the internal medicine, please remember that these batch are the batch na walang clerkship na hospital. There are, kasi po, ano yan, these are the pandemic batch. So yung fourth year nila is virtual. So please alalay, please extend patience as much as possible. I know it's on top of your administrative work and clinical work, but we do appreciate that if you take time to assist and explain to these PGIs. Kasi yung nakita namin sila yung nag-rounds kami yung day one, you can see that really they're trying their best to adapt to the new normal at the same time to go around the hospital because it's big hospital despite the hospital tour. For IM, and I think it's the rest of the departments also, IV insertion, intubation, polycat, NG insertion, ABG, ECG, venipuncture, and ECG reading. For pediatrics, OGT insertion, pediatric IV insertion, EINC, lumbar puncture, and spinal tap. For OB-GYN, CTG interpretation, episiotomy and repair. For Gen Surge, we have wound dressing, gloving and gowning, donning and doffing. For orthopedics, cast and splints. For family medicine, teleconsultation. Emergency medicine, BLS, ACLS, PALS. Although I know we need to pay on this, and there's a number of person that's only required per session. So we will check the schedule. And for anesthesiology, PACO monitoring, spinal epidural anesthesia, and general anesthesia intubation. So yun po. I will send this in the on the page. And then for yeah, requirements for graduation, let's always remember it really depends on your department, but on the PET-D end, we have to receive an endorsement letter with final resident evaluation, and then two hard copies of your hardbound research paper or approved protocol of final research paper of the resident and fellow who will graduate, and then of course the 500 peso settled graduation fee. And then, in order to be issued a certificate of training, you must submit the following additional documentary requirements apart from the stated above. So, two hardbound copies of research paper, final and closed, and clearance from the hospital. And for those deployment requirements, certification from the receiving hospital that they completed their period of service. So, yun po siya. Okay, thank you. Wait ha, do you have questions? We will stop sharing. Uh-huh. Yeah. Do you have any questions on this? On the PGI's end? In case, again, I would like to remind everyone, please remind them to implement strict infection prevention control procedures as much as possible because we cannot control them. They're going from time to time from one area to another, and there's always a possibility that during lunchtime they will meet up. So at least on our end, we will remind them of their responsibilities. Again, if there are interns who are having symptoms from 7 to 3, you can refer them for PHS for consultation. After 3, please refer it to me. We'll do the referral to the PHS or isolation or to the family medicine. And then if there are patients, if there are PGIs whom you observe is having mental health concerns, please do inform us so that we can refer them refer them for professional help. Because I had one last night who informed us that kaka-diagnose niya lang. So as much as possible, also on your end, if you feel that way, please don't hesitate to message me or message Dr. Concha if you need professional help. It's okay not to be okay, especially in these challenging times. And then what else? As much as possible, you can always message me if you have concerns. on your end. So no more questions. Okay. So again, we are
Hello,
already
sir. Good
here.
morning.
Yes, sir. Sorry. Good morning.
Yes, sir. This is Dr. Kagampang from Urology po, sir. Question po,
Yes,
sir. Are
sir.
we already part of the PGI rotation?
Ah, Doc Clean, I will give it to you.
Euro is asking about rotations of PGI in
Yes.
urology.
Yes, Doc.
For now,